Well, sometimes all it takes is a phone call to change someone's life. And Alison, you got that phone call into your Ask Alison, a series from a teacher desperate to help one of her special needs students find a dentist.
As you know, I have been on this story for 7 months, and now this morning, the first part of our 3-part series that's not only helping to change one boy's life, but it's also exposing a larger systemic problem.
Hi, Alison. My name's Tricia Pimer. I am a special educator in Westerly.
That one phone call brought me here.
Nolan, are you feeling okay today?
To meet Nolan Gingerella, born in Westerly.
He's a miracle for all he's been through.
He likes the Celtics.
He loves the Celts.
Especially
Celtics
likes
Nation.
the Celtics now.
His mother, though, knew 20 years ago when she gave birth that Nolan's life would not be easy.
Right from me having a C-section, they took him into surgery.
At that time, doctors diagnosed Nolan with encephalitis, which caused brain inflammation. All these years later, Nolan copes with a seizure disorder managed by all these medications. And if all of that wasn't tough enough, there's more.
He doesn't talk.
He doesn't talk.
He has seizures.
Has seizures.
And he's in a little bit of pain right now.
Yes,
How
he's
come?
in pain because he has 2 teeth that need to be extracted. And to find a dentist that will do the extraction is very difficult.
Nolan, does that feel funny?
We've come to the conclusion that when he's sticking his fingers in his mouth that he's in severe pain.
How many dentists do you think you've called in the last 6 months to get help?
I'd say at least 20.
At least 20.
Yes.
What is that like? You're on the phone. Is it fair to say you're almost begging for help right now?
At this point, yes, we are.
So how do you get up every day and just keep fighting, Dana? This is a lot.
It's a lot, yes. We got to do it. We do it for Nolan. Off to school, Noli.
And Nolan isn't alone. He's got a team of advocates working for him, like his teacher, Tricia, who called me here at NBC 10.
We are running into an issue right now with dental care for people with intellectual and developmental disabilities. And I know that you are the person that can help with this.
You called me.
I did.
And the minute I heard your voice, I'm like, this is a teacher who wants to do something. At what point were you like, I need to make another phone call because every other phone call isn't going anywhere?
So in talking with our team, it's a capacity issue. And I think that we just wanted to shine light on the lack of capacity for medically complex people who need dental care.
So I do think that...
So I went to the one place in Rhode Island that primarily works with special needs patients. I told them about Nolan, his situation, my news, not news to them.
I told you about 20-year-old Nolan who needs teeth extractions and he's desperate for some help. Is Nolan alone?
Not at all. We get probably close to 100 patient referrals a week.
What is the answer, big picture in Rhode Island?
We definitely need more facilities and more dentists that specialize in this special care dentistry, as we call it. Right now, we're pretty much the only place that takes care of these specialized patients.
So mothers and teachers like Dana and Tricia have no choice but to fight. It takes months and months, and patients like Nolan suffer.
Do you feel like after telling the story, somebody's going to step forward and they're just going to figure it out?
I hope so. We have worked with some really wonderful people that want to help. So I think that if this story comes out and people can just all hear it at the same time, maybe they'll get together and it'll be a wonderful Rhode Island thing.
And that's where we are. Coming up tomorrow, I sit down with the people who run the Samuel Sinclair Dental Center in Providence. It's really the only place like it in Rhode Island that can help someone like Nolan. I asked them, what does it take to get Nolan and other special needs patients in? What I found out is that the odds are stacked against them.